Good afternoon, everyone. It's good to be back here in person. I have three things I want to talk to you about. The first thing is the new variant. James, could we put up the slide that I made for that? One of the things I missed the most about not being here in person was it was harder for me to share some of these little things and draw attention for any of the younger audience that's still watching me. So science is cool, even though it's not always happening in a context that's fun. So let me use this as an example. That's a website up there, gisaid.org. It's www in front of that. This website shows the genomic mapping of the SARS-CoV-2 virus, which is the virus that's causing COVID-19. On the left-hand side of your screen, you can see those lines with all the dots. It goes blue, dark green, light green, all the way down to yellows and oranges. If you go all the way to the bottom left corner of that, that is the very first genomically sequenced SARS-CoV-2 virus. So that would probably be the Wuhan variant for where this all started. From that one variant, or from that one virus, over time mutations occurred. And this is typical. This happens in viruses all the time. As those mutations occur, you start to see branch points where essentially new families or new branches of the families of the virus develop over time. And the longer this goes on, the more you see more distinctly different families that develop. So across the bottom of that graph, it's hard to read, I'm sure, on your screens, but across the bottom of that graph, it shows months. So you're moving forward in time from the left-hand corner to the right-hand side. As you go up, that's just showing further variation, new mutations that are occurring in the virus. The vast majority of these mutations have no clinical meaning. They have no implications for us for the infection. They're mutations that don't make it more contagious, that don't make it more lethal. They don't functionally have an impact on us if we get infected by it. But that's not true for all of the mutations. Some of the mutations do cause the virus to become more effective. Where it causes the virus to be less effective, those generally die off. Natural selection weeds those out. But where it helps the virus to be more effective, that's where it's a problem. We have found now for the first time in northern Kentucky, in Kenton County, 2 individuals who tested positive and have subsequently been found to have the B117 variant. That's the one that we believe was first found in the United Kingdom. That variant is more contagious. So I'm going to put this in context again in a different way. It spreads more easily. It means if you get exposed to it, you may be more likely to get infected by it. And so that means that it can infect more people more quickly. It's not more dangerous for the person who gets it than the previous version of the virus, but since more people can get it more quickly and more easily, that means you could have more people get sick, more people who die. Not because it's more lethal to the people who get it, but because a lot more people get it, and then that changes the overall number of people who have the worst outcomes. So it is more important than ever that we wear our masks, that we watch our distance and stay 6 feet or more from each other, and that we wash our hands. And if you get exposed, please stay home and quarantine. If you have symptoms, if you have fever and cough and infectious symptoms, please get tested if you think it could be COVID, and definitely stay home until you're well. Those variations, the more we let the virus spread, the more the virus has a chance to replicate, the more mutations occur, the more risk we have of more harm and danger. So please, wear your mask, watch your distance, wash your hands, and stay home if you're sick. I want to thank Gravity Diagnostics. They, along with others, there's certain laboratory equipment that runs certain assays that allow us to find some of these. So this was called an S-gene dropout. There's a certain pattern that shows up with that variation, the B117 variation. When that shows up, it alerts us this might be that B117 variant. Gravity Diagnostics works with us, as do other labs, and they found that pattern in these specimens. They sent the specimens to our lab here at the state, and we did genetic sequencing, and that's how we found that. So thank you. I have one other point to mention, and that, the importance of testing. I have 2 other points. If you could put up the testing slide, James, so I can remind folks about this. On our website, kycovid19.ky.gov, up at the top, there's a navigation bar, and it says testing, COVID testing. If you go there, There are 364 locations on our map. Now, I suspect there's even more than that at this point, because now that it's so much easier to get, probably sites aren't always coming to tell us. But please, if you have a site and you're not on our map, there's a registration link on the page. Please identify yourself so people know you're there. There's also a list for where we have partnerships with some local health departments, the federal government, Norton Healthcare, St. Elizabeth's, University of Louisville, University of Kentucky. Those are places where the state continues to support testing that is provided at no charge to those of you who sign up. So please take advantage of that and make use of that. The last point I wanted to mention for tonight is about the vaccines. I'd like to highlight just a few points the governor mentioned. I mean, I'm real proud of the public health team and the state government team at large and the local health departments we've worked with. Team Kentucky has really done a good job, folks. I mean, that sounds self-serving, but it's not about me. There's this team of thousands of folks across the state working on your behalf. The end output of those results are that we've had some of the best testing in the nation earlier than many places. We have the lowest, among the lowest mortality rates, in the top 10 for the lowest mortality rates in a state that has bottom 10 overall public health standing, unfortunately, because of the challenges we face for overall population health. There are a number of things. We've never had a hospital yet get overrun and overwhelmed. That's a lot of hard work from a lot of people, and thanks to the entire state and the public health community and the hospitals and the doctors and the nurses and all the other clinicians and all the state government employees and local government employees. There's been a lot of people working on your behalf. With the vaccine rollout, when we started this week, when you looked at everything we could have administered through the end of last week, the governor shared this previously, we had already administered 88% of all the inventory given to the state program to use. The long-term care facility program has had a slower rollout, but the state had given 88% of all the inventory it had to give out. Remember, we set the target on January 4th for 90%. That's pretty good 3 weeks in to be that close. As I stand here today, even with all the new inventory we got, and even with the fact that we reclaimed inventory from the nursing home program that was unused to redeploy into test locations, we've still already used 76% of all the inventory the state program had to give, and we still have 5 more days in this week to use up the rest. Our state has been a leader on this. Only 53% or so of the total inventory shipped out nationwide has been used. And I'm standing here saying that even at the beginning of the week when we just got an influx, we're already standing 76% of everything we've gotten at the state program has been used. We have a long way to go. We intend to improve this and make this best-in-class service. The problem is quantity, quantity, quantity. We don't have enough, and so I need to ask everyone to be patient. And let me put this in context real quick. As I stand here right now, we have immunized at least 90,000 people 70 and over. So that means we've gotten 90,000 out of about 490,000 people 70 and over, and that was as of yesterday. So as of today, that number will have gone up. We have a long way to go, but even though I know it's been frustrating, there's still 400,000 people or so 90 and up or 70 and up who have not yet had the chance to be vaccinated. I know I've asked for patience. The governor's asked for patience. We're methodically making progress, and in February, that is going to be the focus as we enter February, to get the rest of the folks who are 70 and up who want to get vaccinated. And I'm confident we're going to make really good progress. When you get the vaccine, it is normal for you to have a sore arm where you got the injection. That's normal. That's your body responding to the stimulus that's the vaccine. It is normal to feel achy, to feel tired, to feel a bit run down, to feel like your energy's lower. It's even normal to have a low-grade temperature. Those things are normal. That is your body's immune system responding as it is supposed to a vaccine. I've been surprised, actually, in talking to people who say after they get a tetanus booster, after they get other booster shots, some people's immune systems just respond more strongly. That is normal. It's not a side effect. It's not a complication. It's not a reaction. It is your body's immune system responding as it should to the vaccination. So if you have that, please know that means your immune system is doing what it's supposed to do and is now going to be better primed to prepare you. It remains a privilege to serve. I'll be back tomorrow. We'll have a lot more information about the vaccine rollout. And thank you,